Hello and welcome. I'm Dr. Lisa Alberts, a doctoral level nurse practitioner, and I'm glad that I have this opportunity to talk to you about telehealth or using technology to improve your health. We will review the history of telehealth, identify benefits and challenges of using telehealth, and examine different telehealth technology. I will be referring to my notes during this presentation just to make sure I don't forget any important details. During this unprecedented time of a worldwide pandemic, healthcare is being transformed as more and more people use telehealth. Providers have had to rapidly shift to offer healthcare services, and many people are now seeking out providers and choosing those providers that use telehealth. Telehealth is an important resource for you and may help you keep safe during this time. Even though I teach and work in New Jersey and Pennsylvania, my healthcare roots started in the South at Duke University in Durham, North Carolina. I'm currently nursing faculty at LaSalle University in Philadelphia, Pennsylvania, and I also work as a nurse practitioner and currently see patients using telehealth. Many of you may be familiar with the concept of a physician house call. I've heard recently that telemedicine is the 21st century version of the doctor's house call. Unfortunately, it took a pandemic to bring telemedicine into the 21st century. The highly infectious new coronavirus, COVID-19, has put doctors' offices and hospital visits off limits to all but emergency cases. Excuse me. Think of telehealth as a tool that you can use to connect with your healthcare provider. The term telehealth is used to describe different ways to provide healthcare using technology and telecommunication. So really, telehealth is healthcare, and telehealth is for all of us to use. It is now available in all 50 states, and more than 50% of hospitals in the United States now have telehealth programs. The Department of Veterans Affairs operates one of the largest telehealth programs in the country, with more than 700,000 veterans receiving medical care and advice via computers and mobile devices. These telehealth services have improved healthcare to veterans and expanded access to care. My patients have been grateful to continue care with me via telehealth, and I've been grateful that I can stay at home and virtually follow up with my primary care provider and my specialists. Providing and using telehealth has offered me and my patients great security. Now, believe it or not, telehealth is not new. Healthcare communication using technology, referred to today as telehealth, has been around for a very long time. In the 1800s, the telegraph was used to communicate long distances by the military and also used to provide medical consultation. In 1876, the telephone was patented and used to transmit speech electronically. And in the 1920s, there was a popular radio show called The Radio Doctor, where a doctor would talk to and diagnose a patient over the radio. In the 1940s, our first X-ray images were sent electronically. And in 1950, at the University of Nebraska, they developed the first two-way interactive television program to teach their medical students. The University Miami School of Medicine in 1967 used voice radio channels to transmit heart rhythms from rescue units in the field to the hospital. These technologies are so mainstream now that we don't even consider them as early telehealth, but they really are. In the 60s and 70s, NASA used telemedicine to provide healthcare in space and teleultrasound to examine and diagnose conditions from space. And in the 1980s, pacemaker remote monitoring became possible via the phone, saving lives and precious time. The Veterans Administration has used telehealth and telemedicine and allows veterans to remotely track their vital signs and blood sugars and send this information to their providers. Prisons have been using telehealth to reduce costs and improve access to care to specialists. Telemedicine became popular in rural America, where people had limited access to healthcare. And in 2016, $16 million was given to researchers to improve access in rural areas using telehealth. Advances in technology like telehealth can overcome healthcare disparities by redistributing knowledge and expertise to where and when it's needed. But most people really didn't start using telehealth regularly until COVID-19. Americans and those around the world needed to shelter in place and maintain social distancing. And this resulted in less use of healthcare and reduced access to care. Early on in this pandemic, people were neglecting to follow up with their providers, and some even lost their lives to potentially preventable conditions. The rapid shift to telemedicine has improved access to care for many. Researchers from the American Association of Retired Persons, or AARP, report growth in the telehealth market from a $14.3 billion industry to a $36.2 billion industry just in 2020. Although there are few positives coming from this pandemic, the public health crisis has made telehealth available to all Medicare recipients. Now, telehealth itself is a broad term, and it describes different types of remote healthcare. Telehealth includes not only telemedicine, which is real-time video conferencing between a provider and a patient, but also the broader term telehealth can include providing healthcare online, providing tools to allow patients to monitor their health at home, providing health education, and access their health information through a computer or a smartphone for patients. Telehealth also means providers can consult with one another to share information. This is an example of a telestroke robot. These robots have been used for some time now, and you may have come across one of them. They're placed in small community hospitals that do not have specialists available to manage acute conditions like a stroke, which require immediate and accurate assessment and treatment. This robot can save lives by connecting a local provider with a neurologist or a stroke specialist that may be hundreds of miles away. The specialist can direct the local doctor or nurse in examining the patient. The robot can see the patient, access the patient's scans and radiology images to provide diagnosis and treatment recommendations. Many smaller hospitals do not have stroke specialists, so this robot can save lives. Mobile health is another term used to describe technology under the broader term of telehealth. Mobile health allows a patient to self-monitor and then send that information to their provider using a mobile device. Mobile health is also health on the move, allowing patients using a mobile device to access care and their provider when they're away from home, like on vacation, or when they don't have access to a local provider. Using a mobile device, you can track your food intake and your blood sugars and report them to your provider to help you manage your diabetes. Mobile health also means using the patient portal to check your lab and test results and email your provider or even schedule an appointment. There are different types of telehealth. You and your provider can connect at the same time in a live, synchronous, face-to-face encounter using a computer, smartphone, or iPad. You can use things like Zoom or FaceTime or Skype through your computer or a smartphone to talk directly to your provider and then to see them in real time. Your provider sees you as well, and it's just like being in the same room. Your provider can do an examination, identify your concerns, make a diagnosis, and provide treatment through telehealth. Your provider might use equipment that helps them listen to your lungs, heart, look in your eyes and ears, all through the computer or smartphone. I've seen patients remotely on a phone, in their car, or on vacation. When I see a patient for a telehealth visit, I sometimes forget that there's a computer screen in front of me. It really is amazing when you can accomplish these things through telehealth. Providers can electronically send lab orders, prescriptions for their patients. Telehealth can help you manage many acute and chronic illnesses like a sore throat, a rash, and chronic health problems like diabetes and hypertension. Another type of telehealth is called store and forward technology, where information is stored in your computer and then forwarded to a provider or a specialist. The first store and forward technology we used was with X-rays. So you no longer have to pick up your films or have them mailed or sent via a courier. Today, with teleradiology, your X-rays are stored in the computer and can be forwarded to your doctor electronically for them to review. You can also send information about your health directly to your provider. For instance, taking a picture of a rash, or perhaps you're tracking your blood pressure and have some blood pressure recordings to forward to your physician. These are examples of store and forward, where health information is stored and sent. This exciting technology is an example of remote patient monitoring. Remote patient monitoring means a device like a cell phone or a smartwatch that collects health information like your blood pressure perhaps, or your heart rate or blood sugar, and blood oxygen levels, and then sends it to your provider. There are devices that you can purchase at local drugstores that measure your blood oxygen level. There are devices to wear that record your heart rate, and some even record a heart rhythm or an electrocardiogram. A senior can wear a device that measures vital signs and alerts their caregivers when something is wrong, like when your blood pressure goes too low or too high, or when your heart rate is irregular. There are devices that you wear that alert someone if you've fallen and need help. If you live alone, you can wear a device so at the push of a button, you can access emergency services if you need help. Collecting important information at home reduces your need to travel and improves health and independent living. Many insurance companies now cover the cost of devices that the patient can use to remotely monitor their health. And that, of course, has been increased during this pandemic. I'm sure some of you can relate to this photo. Do you feel disconnected to your family or healthcare providers during this time? Using telehealth keeps you connected. The Center for Disease Control has recommended that people, and seniors in particular, continue to get routine care and follow-up, even though there are quarantine restrictions across the country. Some positive policy changes that have occurred during the COVID-19 pandemic include improving insurance coverage for telehealth services. These policy changes have decreased barriers and improved access to care through telehealth. The federal government has changed some rules to make it easier for providers and patients to access telehealth. You can stay connected to your provider or a specialist while staying at home and staying safe. If you live far away from a hospital, you don't have to leave your home to access healthcare. If you have access to the internet or cell service, you can use telehealth. Don't put off routine checkups. Do these checkups from your home using telehealth. For seniors, talking with a provider through the phone, computer, or iPad may be easier than going to the office. Telehealth can save on transportation costs. By staying in contact with your provider, you minimize potentially unnecessary hospital visits that may happen if you don't get the care you need for your chronic condition. Telemedicine costs less, since many insurances, including Medicare, do not charge a copay for a telemedicine visit. During the pandemic, staying at home may save your life, since you reduce your risk of being exposed to the coronavirus and the flu. If you live alone, telehealth can provide comfort and security for you, with access to your healthcare team in real time and often anytime you need it, increasing your chances at independent living. Telehealth can also help your family and caregivers stay connected to you by allowing them to attend a visit with you remotely, linking them into the visit or giving them access to your health information on the patient portal. If your regular provider is not available or does not use telehealth, there are programs across the country that can connect you remotely with a licensed provider in your state, often the same day. I have patients who want their family members to attend a visit so they don't have to repeat everything I say to them later on. I send the family a link through an email or a text that is secure so they can be at the appointment without having to get in the car or travel a long distance. Being able to connect with a loved one for a visit reduces everyone's risk of exposure and provides comfort and security for the patient. You can communicate with your provider or the office by video chat to see if you need to come in to manage a medical concern that may require acute interventions in person, like a wound that may need to be sutured. Telehealth reduces health disparities by increasing access to primary and specialty care if you live in a rural area. If you live far away from a specialist like a cardiologist, a neurologist, or a vision specialist, you can see that specialist virtually using telehealth, or your family doctor can consult with that specialist for advice. Telehealth can be used in nursing homes where access to physicians and specialists may be limited, and patients can remain safely in their beds as nurses and care providers work together to provide care via telehealth. Using telehealth reduces wait times in the office. When you use telehealth, you wait in a virtual waiting room on your computer. So you can be sitting on the couch having a sip of coffee while staying comfortably at home, waiting for your provider for a healthcare visit. There are many specialties that use telehealth. Family practices use telehealth to care for healthy people, children, patients with chronic conditions like high blood pressure or diabetes, even pregnant women and older adults and individuals with behavioral health needs. There's something called tele-ultrasound that can improve healthcare for many, especially pregnant women in remote settings that do not have access to such specialists. Telepsychiatry provides case consultation, medication management, patient evaluation, and crisis response to hospitals and prisons that don't have these services on site. Telemental health can connect you with a mental health provider or a therapist when you need it the most from the comfort of your home. Therapy and counseling services are done via telemedicine and improve access to mental health services and ongoing care. The need for mental health services has increased since the start of the pandemic. People feel disconnected and often isolated. Children are homeschooled, and many areas have increased stress in the household. Families cannot see their elderly members, so connecting via telehealth with a mental health specialist is easy and very effective. Also, connecting with your family through technology like Zoom is helpful. In primary care, rashes and skin conditions are often seen by the primary doctor first. These providers can use telehealth to consult with a specialist like a dermatologist, so you don't have to wait months to get a specialist appointment. You can see your doctor Send them a picture of the rash, and they can then consult with a specialist. There's also teleophthalmology. Teleophthalmology is yet another specialty area that uses telehealth commonly. You can reduce trips to the eye doctor by allowing your primary provider to take a picture of your eye through the camera on the computer and then send these pictures to the retinal specialist for consultation. People with conditions that place them at risk for infection, like those with cancer, lung disease, heart disease, can stay safely at home and seek health care where they can get treated quickly and safely through telehealth. Most acute and chronic conditions or illnesses can be treated using telehealth. Healthcare is rapidly changing, and affordability for telehealth is also changing, particularly during these very challenging times when we're asked to stay in and avoid unnecessary travel. Conditions like allergies, high blood pressure, diabetes, arthritis, as well as acute illnesses like urinary tract infections, eye infections, viruses, and rashes can be safely seen and treated using telemedicine. Mental health providers can do medication checks and therapy via telemedicine. And if you've had surgery, many post-op follow-up visits can also be done using telemedicine. I'd like to give you a quick example of how to use telemedicine to manage a chronic condition, such as treating high blood pressure. You can use a smart device to collect blood pressure readings, like a smartphone or a smartwatch. You can use a smartwatch to then take an EKG reading or a heart rhythm and send it directly to your provider. You can use your patient portal to watch a video on heart-healthy diets. You can also use the patient portal to communicate with your doctor's office, to check your blood work or any tests that you've had completed, and to connect with your family members. Finally, you can use telehealth for a face-to-face visit through a video conferencing tool like Zoom in order to manage your high blood pressure remotely. There are certainly some challenges to implementing telehealth. Some of these challenges are access to technology and telecommunication. In some areas where there isn't access, it's sometimes difficult to obtain these services. If you don't have access to a phone or an iPad or a computer or a stable internet or phone service. But sometimes these services can actually be done just over the phone without the video portion. Insurance reimbursements are certainly easier now during the pandemic in this public health emergency. And most insurances are reimbursing telehealth as if it was a face-to-face visit. And that includes Medicare and Medicaid. But private insurance coverage may vary from state to state. Some people prefer a face-to-face visit, especially if you're lonely and need to connect. But really consider a telehealth visit instead and invite your family to join you. During this public health crisis, this may be your best option. It's really important to know when not to use telehealth. If you have chest pain, signs of a stroke, heart attack, or seizure, or trouble breathing, call for emergency services. Don't use telehealth for a serious, life-threatening condition. And broken bones and head injuries should be seen in person. If your symptoms are new or unidentified, it may be best to see a doctor in person. Using telehealth, you can connect with them directly and see if they advise you for an in-person visit. Telehealth is used to supplement, not replace your healthcare providers. If you're unable to leave home, a telehealth visit can provide you with access to healthcare from home. How many of you can relate to this photo? I know I can. As a more mature nurse, I can remember when the electronic health record first came out. I was very nervous that I would not catch up to the technology. I had my first cell phone when I was about 40 years old, and many young people today are called technology natives. They have experience with cell phones and technology at a very early age. Seniors have been a little slow to adopt telehealth technology. Computer anxiety may be the cause. There are ways to reduce computer anxiety. One is to spend time with friends and family that use telehealth and technology to learn some helpful tips. Family, friends, and your provider's office can help you if you're unsure how to use the technology. I started using Zoom, a video conference tool to talk to my family and friends since I've been unable to see them in person. This practice has helped me learn how to master telehealth. It took some time to figure out how to turn on the camera and how to find the mute button, but it's possible. Telehealth technology is there to make your life easier and to help keep you safe. It's safe and secure, and your health information will be protected, just like an in-person visit. Another way to reduce your anxiety is taking an online basic computer class to give you more computer confidence. Access to a stable internet and phone service is important, and in some areas can be a barrier to accessing telehealth. Sometimes you can just use the phone without the video to connect with your provider, especially if it's for a routine check and not the initial visit. And hopefully, by watching this video, you will be more knowledgeable about telehealth and understand how it can help you. Telehealth has technology that is growing in leaps and bounds and becoming much easier to use. There are telehealth kits that you can buy from places like Walmart or Best Buy that allow you to show the provider on the other end of the phone your ears, your eyes, your throat, and they can even listen to your lungs and your heart through your smartphone or a computer. Seems incredible, I know. These kits connect with a licensed healthcare provider network, and one such device used to examine this young child's throat is shown here. There is a telehealth service that providers use that doesn't require you to download anything. The provider sends you a link on your phone or computer via email, and the patient clicks the link and is connected directly to the provider. You can access telehealth through things like Zoom, FaceTime, Skype, and Google Meets, and these have all been approved due to the pandemic. The tools that are used to help the provider conduct a telehealth visit are often called peripherals. There are tools available like a smartwatch that will take your vital signs, your heart rhythm, send your location through GPS, track your activity, and some even do electrocardiograms. The location services can be life-saving, especially for individuals with dementia. The Food and Drug Administration, or FDA, has approved some of the smart devices as medical products. That means some insurances may cover the cost. Apple, as shown here, makes a smartwatch that is FDA cleared with an EKG feature that can record and send an electrocardiogram to your provider at the push of a button. It will also alert the wearer if there is an arrhythmia or a heart rhythm problem, and will let you know if you should get help. The FDA approved expanded availability and capability of non-invasive remote monitoring devices is largely due to the pandemic. As you can see, this Apple Watch is recording an electrocardiogram and then can export a copy to your physician or your cardiologist just by pushing a button. It also saves the recording so that you can refer to any changes that might occur. If you do not have access to the internet, cell service, or don't have a computer or a device, there are telemedicine kiosks that are available in some areas. Many communities are setting up centers or kiosks for people to access providers. Some kiosks are located in churches, stores, pharmacies, or community centers. Perhaps you have seen one. This unit is a project run by Texas A&M University in rural areas of Texas. As you can see, the patient enters the kiosk through the glass sliding door and then closes the door and screens come down for privacy. The patient inside the glass kiosk can connect with a provider remotely who is licensed in that state. The provider will instruct the patient to use some of the peripherals or tools inside the kiosk to perform an examination, listen to the heart, look in the ears and eyes, and listen to the lungs. The provider can ask the patient questions, can make a diagnosis, and can also make recommendations for follow-up, order labs, or medications based on the patient's needs. I've also seen such kiosks in airports, and maybe you have too. There are also standalone telemedicine units and some that connect to the electronic patient record that your provider uses. And there are even drones that bring medications and lab supplies to patients in very remote areas. Pharmacies, nursing clinics can use these telemedicine portable units shown here for access to licensed providers anywhere. I've seen pictures of nurses in the field in a remote area using these kits to bring healthcare to remote villages or hard to reach places. During this pandemic, insurance regulations have changed to allow the patient to stay at home and the provider to be able to bill as if it was a face-to-face visit without charging the patient a copay. For Medicaid, almost all states have expanded coverage for video visits. Medicare must pay for telehealth visits. So check with your insurance company or your provider to get details on how you could access telemedicine in your community. So there's some important steps that you can take to prepare for your telehealth visit. Review the instructions from your provider's office to make sure you know how to connect. Sometimes these can be a little complicated, so don't wait to the last minute to review them and ask questions of your provider's office to make sure that you can connect easily. You might want to consider investing in a scale, a pulse oximeter that measures the blood oxygen level, an automatic blood pressure cuff, a smartwatch, or a fitness tracker. Talk to your provider about having a telehealth visit and find out if they don't provide telehealth, where there might be a kiosk if you don't have access to the internet or cell service. Sign up for your patient portal and consider giving family access to your patient portal or inviting them to attend a visit remotely. Make sure the equipment is gathered ahead of time so you don't lose time during the patient visit. Select a quiet space with a door for privacy, and make sure you have good lighting so that the physician or provider can see you through the computer, camera, or cell phone camera. And have a paper and pencil available in case you want to take notes, or if you want to write down questions ahead of time to ask the provider. It's really best to have that visit from your home or office. It's very difficult to examine a patient and have a conversation if you're in the car or on the beach or in a restaurant. And I've encountered patients trying to use telehealth in all of these conditions. So the future is here. Here are some tips on how to get started. Get started by checking with your insurance carrier and see if they cover remote visits, home monitoring, and online therapy. Find a doctor on demand that uses telehealth if yours does not. There are many companies that provide telehealth services now directly to you. These services use real doctors and nurse practitioners licensed in your state that can diagnose and treat your illness safely, and if needed, electronically prescribe a medication to your pharmacy or send an electronic lab slip to your lab. Sign up for your patient portal and consider having family attend a remote visit with you from their home or have access to your patient portal information. Here's some resources I'd like to review with you. The TEXLA Center is a federally funded program and one of the certified telehealth regional centers designed to provide technical assistance to telehealth programs, providers, and patients in Texas and Louisiana. There are doctors on demand that are approved in Texas through Amwell, Doctor on Demand, Guru Medicine, and Karis, K-A-R-I-S. These resources are all available in Texas. Texas Medicaid offers free telehealth and telemental health visits through AmeriGroup. There are other resources that are not listed here, including AARP, so check their website out, and also healthit.gov. Patients and providers can access information on telehealth and stay up to date on changes to the telehealth rules and regulations. There's Texas Health Aetna through CIRRUS, C-I-R-R-U-S, MD, a vendor of text-based telemedicine that provides asynchronous, ongoing communication. This service has reduced ER visits in northern Texas, so it's text-based telemedicine. I hope you enjoyed this presentation and learned about the benefits of telehealth and how you can improve health and increase your access to healthcare through technology. Telehealth is more popular now due to the pandemic, but researchers believe that telehealth is here to stay and will continue to improve healthcare to all. Thank you for watching.